Okay, good. Now let us to start our second lecture in health education. As we are last time we are studying about the definition of health education, and also we are mentioned the health education is a pillar of the public health. In this lectures, in this in second lecture, we are going to see the definition also, and also we can go through the why the health education is important. Additionally, you can go to see the some concept, core concept in health education. Moreover, we can see the scope, and also you can go through the objective of the health education. Concern for the health education. Before to go to health education, let us to see to give the definition of the health. As WHO mentioned, the health it is not just absence of the disease, which mean physically or mentally or socially. Yeah, but it's how we can stay healthy, even in the psychological side. This is the this is the health definition based on the WHO. Additionally, the health is a process that can help the people or the community to give them a good choice, like can teach the people or can teach the families or communities by the good information, and also give them the good skills that can help them to protect and prevent themselves from the disease, yeah, and also help them to do the good choice in his life, yeah. To do the a good choice in his life. Like sometimes it's very important to clean your hand to avoid to affected by some germs, and also it can eat it can also give you the advice or give you the give you the support to eat the good food, yeah, that can let your health to be more good and also to be more correct. Additionally, let us to go through the health education in the WHO is a process that helps the individual or community to increase to control over the determinant of the health and improve their health. Yeah. This is the health education based on the WHO. Now let us to go to second slide. In this slide, in this slide, we are going to see the health education is used in the health in the schools, and also in the hospital, and also in the workplace. This is the scope of the health education. The concept of the health education, one of them is the health literacy. What does mean the health literacy? The health literacy that it means able you or give the people or the community to able to understand the health information, and this information can help them to do the good choice. For example, if the person can read the medical read the medicine label, and also know when and how can take the medicine, this can help them. This is called the health literacy. By this way can help you to do the good. My slide, is it visible? Hello.
Yes, it is visible.
Okay, let us to go through it to share it again. The concept of the health education, as I mentioned, health literacy can by the health education to be more aware how you can use like label, or if you go visit the doctor and give you the Roshita, or let me to say label, can help you how and when and how you can use that medicine. Yeah, because it's very important to address this issue in good way. The health education can help you to use by the good way. This is the call it health literacy. The second concept of health education call it behavior change. As is so, as you know, the health education aim to change the unhealthy habit. For example, some people they can smoking and also eat not eat more fruit, and also some of them they not have interest to practice the exercise. All this is good for the health, yeah. But the some people in their behavior or in their attitude, they they not they not practice exercise, and also cannot eat good food, and also not have interest to eat the fruit, and additionally some of them they are smoking, yeah. The health education can help you to change this bad behavior by a healthy behavior or by the good behavior. These terms or this concept in health education call it behavior change. To change the behavior from the bad behavior to good behavior or to healthy behavior. This is the second concept in health education. Now let us to go to next slide. Also focusing in the concept of health education. The third concept in health education call it empowerment. Empowerment it means giving people power and confidence to control their health. This is a called empowerment by health education can increase the confidence of the population or the confidence of individual. This confidence can let them to do the good control or healthy control. Yeah, this concept called empowerment. Health education does not tell people what to do, and instead help them to make their healthy choice. Yeah, when they give them this is a call it empowerment. Yeah, by the increase the confidence of the patient or confidence of the community or confidence of the people. Yeah, this can let them to empower to be more confident by themselves. Yeah, to handle that issue. This is the called empowerment. The next concept in health education call it prevention. The prevention is one of the main goals of health education to prevent the disease before it started. For example, teaching people to wash their hands to avoid the germs, and also using the condom to prevent the HIV, and also prevent the better than prevention is better than it is better than treatment. This is a called the prevention. Yeah. Also, this is some concept in health education which you call it the prevention. Teaching the people to wash their hand. As you know, by your hand you can bring yourself a very big health problem. Yeah. But in health education, when teach them the people about the precaution of the disease and also measurement of the disease, this can let them to to be more to prevent them. Yeah, like I say, as I mentioned, there's some example to teach the people, to aware them, to tell them, especially during the outbreak which take place in different places in Sudan. As you know, when in your community can tell them when you are going to market or when you're going out out their home and also contact with the people, and additionally visit the latrine before the food. You have to clean your hand, yeah, or wash your hand to avoid the germs. Yeah. Additionally, use the condom, yeah, to prevent yourself from the sexual intercourse, yeah, like from the many disease like HIV. Moreover, yeah, this is a prevention. Yeah, prevention is means before the happen the disease, how you can prevent yourself. Yeah, this is the concept in health education. The fifth concept in health education call it holistic health. Health education look to the whole person, physically and mentally and emotionally, even in socially. For example, stress effect and mental, which can lead to physical problem like high blood pressure. The health education also not see not not look for the part of the body. Yeah. It's look to all of the body, like mental of the community, mental of the person. Yeah. How they are mental. Is it have some health mental issue? If he has a mental issue, how you can dealing with that issue? Additionally, emotionally, how you can control yourself. Yeah. This is also can give you in the health education. Yeah. Additionally, physical problem like like blood pressure, how you can handle this issue. Yeah. All of this concept is called it holistic health. Yeah. Health education is going to focus in all of the health, not part of the health. Yeah. The fifth the sixth concept is called community participation. The community participation is the means or the good health education involve the community. People are more likely to change if they are part of the planning and running health program. For example, training local volunteers to teach other about the clean water. This concept helps educators to design better program and to dealing with the work. Yeah. Community participation. If as a public health educator or the public health professional, sometimes you need to participate the community from when you are going to design the project or the program, like a program of the prevention of the cholera, of the prevention of the malaria, or the prevention of the communicable disease. You have to participate the community, let the community to be part of this design of the project. This can help you. Sometimes they give you some suggestion or some ideas. All this here can help you and let this project to be very good, and also to be more aligned with them. This can let them to implement it by the good way. Yeah. This concept also call it the community participation. Also, the community will be the part of that the project. Yeah. As you mentioned, if you know about the Al-Ma'ata conference, they are mentioned the health is the responsible of the all people. Yeah. Even the not for the professional, the health professional, all community is the responsible of the health. Yeah. Community participation, it is mean all community to be part of that project. Now let us to see the scope of health education. Yeah, this slide is explain or talk about the scope of health education. Scope is means where and how you can use health education. Where, yeah, where I can use it. Yeah, one of the scope of health education is the schools. School is a place of the gathering of the children or pupils to teach. Yeah. This is a good place can teach the students or teach those pupils with the health education. Yeah, the scope of one of the health education scope is the school. Is a school. Health education is taught in the school as part of the curriculum to students. Yeah, to teach them about the nutrition and healthy eating, and also personal hygiene like brushing teeth and also washing hand. Additionally, physical activities, how you can practice the football. Moreover, the drugs and alcohol abuse. Additionally, the sexual and reproductive health. In at the school level, the health education is going to focusing the nutrition and healthy eating. Teach that people or that students by the what is a good food or nutrition. It is suitable for them health. Yeah, this is the one of them, and also advise them to eat a good healthy food. Yeah, this is the one of them. Second point or second topic in at the school level, it is personal hygiene. Even can find that some teacher at the school level to follow the or investigate the students or just brush his teeth and also how about their personal hygiene, washing their hand, washing his clothes. All this is considered as a health education program. The third point in health education at the school level is the physical activities. Even there, some lesson or some time at the school level give the students or the people to go and exercise the football. As you know, the exercise is very important for the health of the students. Yeah, for the health of the students. Yeah, because give them that will be more energy, very nice. Yeah, and even for them health is very good and let them to be more strong. Additionally, at the school level, the drugs and alcohol abuse they are follow the to follow the or investigate at the school level to make sure the people they do not use the drugs or alcohol abuse. All this can affect in their health. Last point at the schools at the school last point of health education at the school level is the sexual and reproductive health. Can give them the advice to avoid for this. Some of them give them the condom like that here to avoid themselves from the reproductive disease like HIV, syphilis, gonorrhea. All these disease can will affect them health. Yeah, this is as I mentioned the scope of the health education. One of the scope is the school, and in the school during the nutrition program and personal hygiene, physical activity, drugs and alcohol abuse, and sexual reproductive. This is the one of scope of health education. Now let us to see the next scope of health education is the hospital. It is a hospital and clinic. At the hospital level, also as the health educator, you have teaching as a health educator level. Okay, health education at the hospital and also in the clinic. Doctors, nursing, and health workers teach the problem about their health, and this call is patient education, like teaching them about how we can teach them about the diabetic patient, how you can check the blood sugar, advising them for the new mother on the breastfeeding, and explaining how to take medicine correctly. This is a as a health education at the hospital and clinic. One of them teach the patient how you can measure his blood pressure and also how you can check his sugar. Additionally, advice for the new mothers how you can breastfeeding his baby, her baby, to clean her, to clean themselves very nice. Then to 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 bring the Moreover, can advise them how you can use the medicine here. All this is at the hospital and clinic level. The third place or third scope of health education is the workplace. At the During the workplace, in workplace, training training the health worker or the workers on to avoid the injuries. If they're working at the industry or the factory, how you can prevent themselves or to avoid themselves from the injuries. Additionally, can teach them how you can manage their stress. As you know, during the working daytime, some people they can will be stressed because due to the walking and also pressure of the walking. The health education teach them how you can manage your stress. Additionally, give them in workplace smoking session program to teach them that smoking is not good and also how can prevent themselves from the smoking also at the workplace level. Yeah. Additionally, can give the healthy at the work, give them the healthy eating at the work. Yeah, the eating or the food that will be more healthy. This is the third this is the third place of the health scope. As I mentioned, one of them, it is at the school level. Second, at the scope and hospital and clinic. The third one is the work place. Now, also, let us to continue in the scope of the health education is the community. Also, the community also is considered as the scope of education of the health education. In the community, you can teach them how you can use the clean water and sanitation. Clean water must be clean and can be chlorinate the water and also sanitate. They can prepare like latrine at that level to protect themselves. Additionally, at the community level, also you can teach them and give
كده
them.
عندي بس يعني ولا في هناي محلي كويس
Umayma, please unmute yourself for those whom they are doing the interruption. Concern for the communities, as I mentioned, to advise them or to aware them to use the clean water, especially this time. Additionally, sanitation is very important. Each house to prepare or have the latrine at the home level. Additionally, vaccinate the children or the child at the community or the home level. Moreover, family planning. Yeah, family planning also is very important to save the health of the woman or the mothers and also safety of the child. In additionally, also preventing the malaria or dengue at the community level can tell them to control the mosquito or let me to say yeah, malaria by controlling the mosquito and also dengue fever also is transmitted by the mosquito can control the mosquito. Yeah. All this is called the health scope at the community level. As we mentioned, the scope it is mean the place that you can do the health education and how you can do it. Yeah. We are mentioned like four scope of health education. One of them it is the school, and second is the hospital and clinic, and third is the communities, and other of them it's the workplace. Yeah, This is a call it a scope of health education. Now we can go to scope. I see there someone has raised his hand, but let us to finish our lecture. Then I will give you the opportunities of the chance. Yeah. The objective of the health education for the healthier in future, one of them the create awareness that can help the people or community to understand the health problem and how you can avoid them. For example, teach the people the smoking. For those they are smoking, this smoke can cause the lung disease. Also teach the population or the people to clean their hand because when your hand is dirty that can transmit the disease like example AW, cholera, many typhoid, many kind of disease can transfer. This is the called awareness to be aware about the disease. Yeah. Also tell them for the mothers or to the communities to use the mosquito net. This mosquito net to prevent them from the malaria like dengue fever and also like malaria. This is the called awareness. Yeah, to be aware about that things. Yeah, this is the one of the objective of the health education. The second objective of the health education is to provide the knowledge, to give them information about give them accurate information about the body and also disease and healthy habit. For example, explain how to vaccine work to prevent the disease. Yeah, this is to give them the knowledge and also give them the knowledge how you can use the label of the medicine or can use how you can use the word Roshita of the drugs how you can use it. Yeah, this it gives them the knowledge. Yeah, give them accurate knowledge. Yeah, correct information. This can help them to take the good decision. When someone have the good understandable or good knowledge about some disease that can help them to take the good decision and to prevent themselves from that disease. Yeah. It is the second objective of the health education to give the knowledge to the community of individual or people. The third objective of the health education is a change attitude. As I mentioned, there is some bad behavior among our community. By the health education, help the people to see the health issue in the new way and showing that the mental health illness not not weakness, but the health problem is need the care. Give them the because sometimes in health issue at the some community of the money community, they don't care if someone have the mental health issue. Don't care because they not aware about it. Yeah, but the health education tells them this is normal and you have to looking for the drugs or yeah either change the attitude. As I mentioned, another example, for example, some community they are smoking. They are smoking. The smoking is a bad behavior. By the health education or the objective of the health education, how those community to change this bad behavior to good behavior. Yeah, this is a correct change attitude. The fourth to develop skills, teach practical skill to the community or the people. Like example, how you can lead the label. Sometimes you can find that some community, even when he go to market and buy the some food, even they couldn't see the label. Yeah, yeah. But by the health education can tell them how you can go and see that label and see the expired date of that label, because it's very important to take something that is good for your health, yeah, and how you can to resist the peer pressure to smoke or drink. Yeah. This is the objective of health education. One of them, create awareness. Second, provide the accurate information. The third, attitude change. The fourth is the develop skills. Yeah. This is the uh, this is a call it objective. Additionally, they promote health behavior by also health education. This can help us to encourage action to improve the health. Yeah. Sometimes, or the community they have an interest in exercise, even can use the transportation, even for the 500 meters. Yeah, this it is not good behavior. Yeah, but by health education, you can promote this. You can promote the healthy behavior, like do exercise, because the exercise is very good for them health. Yeah. The third or the sixth objective of the health education to prevent the disease, as I mentioned, help people or to avoid to getting sick. For example, teaching about the self-fix to prevent the HIV and also hand washing. Yeah. Also, this is considered as the objective of the health education. The seven objective of the health education is to improve the quality life, help people live longer and happier, additionally healthier life. Yeah. Because if you follow the precaution or follow the requirement of the health, that that can let your body to be more healthy and additionally to be happier, because no disease, no interruption like that. Yeah. This is the objective of the health education. Moreover, the objective of the health education to reduce the health inequality, to make sure everyone, rich or poor, city or in village, have the chance to be healthy, and health education can reach the people who do not have easy access to the doctor. Yeah. Because this is the objective of the health education, to reduce the health inequity. Because when you are aware to prevent yourself, yeah, that can let you to reduce the health inequity. Last point, or last slide, we are going to see also this is the considered as the objective of the health education is to support the self-care, teach the people to take care about their own health. For example, checking the blood pressure at the home or routinely, because when someone older than 40 it's very important to make the routine check to make sure for the blood. Yeah. The health education support this idea, like call it a support self-care. Last objective of the health education to encourage the community action, help the community work together for the better health. For example, clean local water resource and starting to school garden. Yeah. Because health education encourage the community to take action, to do good things for them, their health. Yeah. Yeah, this is the objective of health education. Like 10, one of them is the clean, create the awareness. Second is the provide the knowledge. Third, change attitude. Fourth, develop skills. Fifth, promote health behavior. Sixth, prevention disease. Seventh, to improve the quality of life. Eighth, reduce the health quality, and nine, to support self-care, and 10 is the encourage community action. This is our lecture of the today. Now the follow for you. If there someone have the question or comment, the follow for you. You can join and you can ask here. I don't know who is 01.